So you can see one of our strategies here, given that there are such an amount of expertise in the room, we're bringing forward speakers to deliver very short, brief remarks so that in the breaks and at the meals, you can tag Bernard and you can tag Jacinta and you can go and say, tell me more, and make the connection. No long speeches here, but a lot of tagging of people and their expertise so that you may pursue those discussions. So Susan Barnett is here to chair the next session. Welcome, Susan. Come forward, please, and assemble your team. So the next session will be we're celebrating the role of Catholic sisters, without whom, basically, there would be no WASH in healthcare facilities. These women have been at the forefront of ensuring that healthcare facilities around the world have access to safe water, sanitation and hygiene services. So it's my pleasure to introduce Susan. Come and stand beside me here. My colleague on the organizing committee and my colleague for 15 years now of working together as part of this initiative, part of the organizing team. Susan is a former investigative journalist and founder for Faiths for Safe Water. And she's going to chair this session. And you have a grand challenge on your hand with these remarkable women, huge amount of information and limited time. But I know that it's in good hands. Thank you, Susan.
We're missing a person?
Who would you need?
Jean-Philippe? Hello, come on up. Hi, everybody. So, welcome to a celebration of sisters. But first, I have a confession. So, I grew up in a small city in the United States. It was heavily Roman Catholic. So, I know my pizzelles and I know my mascioli from my rigatoni, right? But when it comes to catechism, not so much, because I'm Jewish. And that I would someday be speaking in the shadow of the Vatican is truly such an honor. And I'm just so happy to be here to be able to celebrate the incredible global group of women called Catholic Sisters. And you're going to see a bunch of them here today, and Jean-Philippe. So I founded an advocacy project called Faiths for Safe Water, because water is the one symbol shared by every world religion. It's true. And like water, sisters are a blessing. Working with sisters, I get to see their exuberance and their influence and their impact. I have seen leaders in the US Congress actually listen because a sister was speaking about WASH. So a little bit about sisters. Catholic sisters are a strong and steady global presence. They number nearly 600,000 and represent an estimated 1,900 orders. The oldest order was founded 1,500 years ago. For centuries, sisters have been a concrete expression of the gospel's love made visible. They are where need and suffering are greatest. When it comes to global health care, they are its backbone. The Benedictines were the first sisters on duty. Monasteries became Europe's main medical centers during the Middle Ages, with sisters providing care. Daughters of Charity trained the founder of modern nursing, Florence Nightingale. Sisters of Mercy worked alongside Nurse Nightingale during the Crimean War, where she implemented sanitation and hygiene reforms and reduced the death rate of injured soldiers from 42% to 2%. Sisters have sustained health care through wars and epidemics and pandemics and crises, putting their lives in jeopardy to this day. They don't only staff healthcare facilities, they founded them, professionalized them, and built systems of care, especially in underserved and resource-scarce places. Today, they are doctors and nurses and midwives and pharmacists and cleaners and administrators and PhDs and they are WASH specialists. What sets Catholic Sisters apart even more is the continuity they bring to a community. They don't go home. Their mission is their home. It's lifelong across years and decades and yes, centuries. We'd like you to meet one of them. She has traveled here from Burkina Faso to share her insights on WASH from the front lines. Sister Ntoya Abugandi has been a daughter of charity for 33 years. She has a master's degree in international cooperation and humanitarian services, and her studies have included 2 courses on WASH. She is a social worker specializing in WASH and humanitarian services at the Notre Dame d'Espérance healthcare facility in Burkina Faso. And I have the incredible honor to welcome Sister Toyin. So, Sister Toyin, set the scene for us.
Yeah.
What kinds of healthcare demands are on your facility in Burkina Faso?
First of all, thank you, Susan, for celebrating the Catholic Sisters. It's such an honor to have you celebrate us. Yes, in Burkina Faso, Nuna, I serve in Nuna. It's in the western part of Burkina Faso, where we have a clinic called Notre Dame de l'Espérance, in English, Our Lady of Hope. The clinic was actually constructed to give hope to the poor people of Nuna. 3 years ago, we were in the midst of really emergency situations when we have, Nuna is just a small city, and we have almost 60 villages emptying into Nuna looking for refuge, sustenance, health, and whatever we can say. And it was at this time that we got a call to do a gap in the health facility in our clinic. And you can imagine how happy we were as workers in these facilities. As at the time, the clinic had no running water. The maternity in particular, we had no wash facilities. We didn't have incinerator. What we had was just a local way of disposing what we have. And there was no light, no electricity, because the clinic is at the outskirts of the village. So that was the situation we have, that women deliver in difficult situations, and we were flooded with so many people, internally displacing persons, coming into the clinic.
And help us understand then the practical impact of the WASH work that was completed in your facility.
A lot happened.
A lot. Yeah.
After the WASH gap, we got, with the help, coordination of the International Project Office, Sister Teresa is up there, and we identify quite a lot. And today, thanks to WASH, we have running water around the clinic. We have the incinerator done, and then we have solar panel, which not only panel the water, supply water, but also provide light for the clinic. So today we have women in particular delivering in very safe environment. When I mean safe environment, they have everything, which clean environment, and more people come now to use the facility. We also have the capacity of water increased by putting overhead tanks, which also, as we have discussed, we cannot have a health facility without thinking of the environment. We have the local community around us who are majorly internally displaced person accessing the water from the clinic, and the water is still enough, because sometimes it could deprive the clinic when people are coming. But we're so lucky that the clinic uses the water and those around us uses the water supply by these WASH projects.
Now, you and I bonded over toilets, right? So tell me about how the toilets have made such a difference.
Yeah, the toilet. The toilet was a big part of it, because before then, we didn't really have a walkable toilet. And I remember talking with one of the staff when we were doing the gap. She has to come to the clinic in the morning and stay till when she finished her shift to be able to go to toilet, because there was no decent and usable toilet. But after the WASH, we got to do, not just for the service users of the clinic, there was accessible clinic for toilet for the men and for women, and also for the staff. So today we have accessible, clean, and we even did compartment for persons with disability. You know, since we are in a war situation, a lot of people have lost some of their members, and some come with wheelchair. So the WASH, what we discovered, took care of that we had toilets especially for persons with disability. We also did a walkway in which people with disability could move around from one service to the other in the clinic without obstruction.
You told me about one man.
Yeah. I remember a man who used to come with wheelchair, and the whole world have to know that this man was there, because when he comes, we needed 4 or 3 people to help lift this man to be able to access the clinic and the services he needs, like from the consultation hall to the lab and then to the pharmacy. We have to lift him. But after the WASH now, and then the rain that we had for the WASH service, this man comes now on notice because nobody carries him. He comes with his wheelchair and is able to access the services around the clinic.
And how old is he?
He's about 38 years old, man.
So old, so young. You're seeing more folks from the outside come in.
Yeah. The good thing, the Notre Dame de l'Espérance in the Diocese of Nuna is the only Catholic clinic we have. And it's at the primary health care level. But after the WASH, we were very fortunate because the humanitarian situation brought a lot of people into Nuna. So this clinic now have many people using the facility because the facilities have been upgraded, it's clean, it's decent, and people have access to basic needs. So we have maybe the medium workers coming to use the clinic. And this has also helped us to be able to save some money for the maintenance of the equipment, because otherwise, most of the people who use the services, this internally displaced person, sometimes we treat them for nothing, because these are people who have come from far away, had nothing on them. So this has helped people who could contribute to use the clinic. And another thing I'd like to talk about was that nobody wanted to come and work in Nuna, but after the service, we were able to get a medical doctor who have accepted to work because the facility is kind of up to what it could use. So it's thanks to WASH that this doctor is there now attending to the many treatment internally displaced persons that are coming into the clinic.
Healthcare faces a lot of competing needs, right?
Yeah.
And WASH, as we know, is often overlooked. How do you help caregivers see that WASH is imperative?
Thank you very much. That's a very good one. You know, initially, when you talk about WASH, people think that WASH is just about water, like we have heard from the beginning since morning. Say, when you ask the Catholic sister, do you have WASH in your service? They say, yes, we have. And it could be the reality, but as Daughters of Charity in health system, we help to stimulate reflection in our service users. We don't dictate to them. We don't tell them you need water or you need this, but we also accompany them to bring out the needs and see the needs that WASH is beyond water. And today I can tell you that, because another thing I need to talk about is the WEFTA. I think Peter is here with us. They accompanied us in carrying out our activity, like training and giving information on what WASH is all about. So today we have, the local people have more information and they are able to come out with the needs of WASH by the stimulation of idea from the sisters.
I love that you stimulate the idea. That's excellent. Yeah. We need to stimulate the WASH idea a little bit more, I think. I know sisters are notoriously humble. Yes. But please tell us how the lack of WASH impacts sisters on a personal level.
Thank you very much. It's on a personal level. When you live in an environment where there is no water, it's really very, very disturbing. Like I spoke about the environment in which the WASH came in. We are in our community, we are lucky we have a borehole. And I tell you, sometimes in the morning, from morning till night, we have the lines of cans and people coming to look for water so we have to open up the community. It's okay, but not many are able to access this. So when we get people helping us to reach out more for people to have water, it's a very joyful and happy thing to us. But the opposite, it can be very, very overwhelming to us when we see people in need of water and they are not able to access it.
Sisters are caregivers that go beyond the clinic. So tell us how WASH is a part of that.
Thank you very much. I like to say that I work in the clinic, but I'm more of a community developer. We have a program in Nuna that's CBID, Community Inclusive Development, and we go beyond just treating or giving medication. Sometimes the problems we meet in the clinic, in the health environment, are problems that has to be addressed from the root, from the community. Take, for instance, a child having diarrhea. And this happened in our clinic. When you see many of the children coming with diarrhea, it's okay to give medicine and give water and they go, but we have to also go to the villages to know, why are these people? Why are many children? So it is when we visit and we talk with the mothers and the people, we sometimes think that it's basic hygiene problems. So sisters go beyond facilities, but we also work on the family level and on the community level. It's a whole, it comes together to bring the wholeness and the best out of the work that we do. And sometimes we have to pray with our patients when they come to us, depending on their belief. Thank you.
Speaking of which, I want to wrap up by going back in time. You never intended to become a Catholic sister, so what drew you in?
Thank you very much. This is very private, but it's okay, I share. Actually, I never wanted to be a Catholic sister. Many years back, I'm a sister for 33 years, thanks be to God. We had the Irish sisters who came to Nigeria. I am originally from Nigeria, but I've been on mission in Burkina for the past 17 years. And I saw these sisters going into, even where we locals, we dare not to go to, going to reach out. So now we have services like leprosy, tuberculosis, which the sisters, without any complex, we're attending to. I actually got admission into university to be a pharmacist. I was about going when I have my U-turn, and I said, I will follow these sisters and do what they do. And I know the next question, Susan, and I will go right into it. And I have a testimony of my life is that I am born into a family. My parents were married for good 15 years and never had a child. And I came after 15 years. My name, Toyi, that's why people say Toyi. Toyi is my local name, which means it is good to give praise to God. And I understood as I grew up my vocation as really giving joy to people. And that has really animated my vocation as a Catholic sister, that wherever I go to, whatever I do, have to contribute to the joy. As my coming into the world gave joy to my family and to my parents in particular. So I have lived my life as a daughter of charity, as a Catholic sister, putting smiles on the faces of people, no matter how little I can do. But wherever I go, people must be happy. In whatever difficult situation I found people, I have to find a way of putting smiles on their faces. Thank you.
Indeed you do. It's now my pleasure to welcome several, is this on? It's now my pleasure to welcome several speakers who know so well the dedication and impact of Catholic Sisters. Jacinta, 2 minutes.
Susan, that was not the deal. Yes, a very emotional subject for me, and I'm glad and thank you to the organizers for having me speak when we are discussing a celebration of Catholic sisters. I am not a sister, another disclaimer, but they compose more than 80% of the people I have to work with in the Catholic Health Network in Kenya, where the facilities I mentioned, the 497, are owned by the dioceses or congregations of religious men and women. But then you find a lot of the people managing them are sisters, even where the congregation does not own the healthcare facilities. I think most importantly for me, and I'll mention this now that I have this, is sisters really help us and enhance the Catholic identity in the health services that we offer. Really representing, they are the frontliners in most cases as nurses, as doctors, as healthcare workers, as social workers. And I said emotional because just like Sister has mentioned about her experience, I grew up in a community where the local healthcare facilities was run by sisters, and in my mother tongue we would say komware, which means the sister's place or the place of sister. And that is what we knew, that really if you're sick, if you need vaccination, that is the place to go to. That was the place that had running water. I was born in a home with no running water. I was born at home, thank God I'm here. The other thing is really why it is significant, the work the sisters do. I will speak for Kenya, and I imagine most parts of Africa, is really they go, we have serious human resources for health challenges of attraction and retention. And as mentioned earlier, is that a bulk of the church health services are not only health, also in education and social work, are in places where the private sector has no motivation to invest there, and the government also has challenges with motivation because there is no crowd to please when they are going to launch those big projects that would give them political mileage. So where we have landslides, we have insecurity, really very difficult places, arid and semi-arid areas, in informal settlements, in urban areas is where we are struggling to attract and retain healthcare workers, is where we have a heavy presence of sisters. In Kenya, we don't largely segregate. We actually do not have a list that says this hospital is owned by this congregation or this diocese. When we, especially for our advocacy work, is that we really just go as the Catholic Church. And the details of the different religious men and women is known on our side. And why how WASH impacts the life of the sisters and their life is, of course, as sisters mentioned, is even in many places where they're providing services, they'll be living in a community life. So there are other sisters in that house where they're living. And they are also providing services either in the schools, in the parish, doing pastoral work, and in the healthcare facilities or as social workers. And so when you bring an intervention of WASH, it's more likely to impact beyond the healthcare facility, to touch on the community and other social aspects of life in that community, including their own life where they live in the convent. So I'm very excited about this, and I also want to join everyone in celebrating the Catholic sisters and the work you do. I hope, and I'm looking forward to actually having a session where we celebrate the ones we work with in Kenya. I've learned a lot through this. We celebrate you, it's not easy, and we are happy to collaborate with the Catholic sisters. Thank you.
Dr. De Silva, if you would introduce yourself. Yeah. I'm sorry.
Hello, good afternoon. Jacinta said all and said very, very good in a very good way, but I will try to say something now. I'm Elaine da Silva. I'm from the Dicastery for Promoting Integral Human Development. So I'm very glad to be here. Thank you for this opportunity. And I'm sorry, maybe I will repeat something, but repeat to confirm. We, as the Dicastery, with deep gratitude, the Dicastery knows the enduring commitment of sisters to providing healthcare around the world, often in extremely difficult circumstances, as we have heard. In many geographical peripheries where other institutions are absent, it's they who remain as a stable presence, drawing close to the most vulnerable and facing side by side conditions of extreme poverty, conflict zones, isolation, and scarcity of resources. These conditions, often experienced by a small team of increasingly older sisters, can lead to fatigue or burnout, or at least the threat of it. Thus, we find the heart of the impact of consecrated life on healthcare through the commitment and presence of its ministry. And because such presence is demanding, we recognize that this challenge cannot be faced by individuals alone. For this reason, the Dicastery seeks to foster collaboration and synergy among congregations, dioceses, international organizations, universities, and donors. And for our part, we reaffirm our commitment to accompanying consecrated persons, especially by fostering networks of support and collaboration, and by facilitating the identification of potential sources of funding, like we are doing here, this meeting. We need to be attentive to the ways that we can support our sister in the work and ministry. Thank you all.
And now we have a quick special thank you from Jean-Philippe, who I just want to clarify is not a Catholic sister.
Thank you. I mentioned this morning about my joy of being with you, of being in Rome. So this is the third element. I'm really happy to be able to celebrate sisters, even if I don't look like the right person. I spent, before wearing this type of jacket in which I feel very awkward, I spent more than 20 years in the field, started in conflict situations, and if I remember all the countries where I worked, I've always been in situation where I had the chance to collaborate with sisters. Started from the first post in '92 in Angola during the war. There were sisters from Spain in Cubal, in the province of Benguela, who were running a hospital when the bombs were falling, the rockets. And always with smile, bravery, and this will always remain in my memory. So I had the occasion to see sisters delivering health services, caring for the vulnerable populations. Jacinta mentioned a lot. I saw also taking care of unaccompanied children, women victims of violence. Always the sisters are there. So I'm happy to be the small voice, a messenger to convey a message, also for a thank you message to the support that is provided to sisters also. So I would like to convey a thank you message to the Hilton Fund for Sisters. On behalf of CRS, we would like to express our deep gratitude for the support of the Hilton Fund for Sisters and to share a few reflections on its impact. This partnership has enabled CRS to work closely with sister-managed health facilities involving several congregations, including the Chameleon Sisters that you saw on the video earlier this morning in the Philippines, the Sisters of Mercy, the Medical Missionaries of Mary, and the Poor Servants of the Mother of God in Kenya, as well as diocesan sisters in Malawi. Together, this collaboration has led to significant improvements in WASH services across 17 Catholic-run health facilities. With your support, facilities strengthen their water supply through solar pumping and storage, upgraded sanitation infrastructure, and improved healthcare waste management and WASH planning. This resulted in more reliable water access, safer sanitation, and improved medical waste disposal and management capacity. Health workers report clear results. My colleague, François mentioned this morning about the drastic reduction, elimination of neonatal sepsis, immediately related to improved WASH services. Also, we saw the near elimination of postpartum sepsis in the same clinic. And another aspect that was interesting when we were talking about sustainability is that the capital investment that took place to be able to improve water services in a facility that used to get water through water trucking, which was very costly, costing about $1,500 per year, which for this facility is a big budget. For a low service level, with the investment to be able to have a solar system, the annual cost of getting water reduced to $270. But the money that is saved is not money that goes somewhere, it's money that is saved to ensure sustainability, to ensure that there is maintenance, to ensure that we plan for the longer-term repairs that will happen in the future, etc. So it's really a worthwhile investment. Collectively, these investments have made facilities healthier, safer, and more welcoming, directly advancing the church mission to serve the most vulnerable and uphold human dignity. So on behalf of CRS and our partners, thank you for your trust, your solidarity, and your continued commitment to empowering sisters to strengthen WASH in healthcare and improve health outcomes and dignity for patients.
So my sister once told me, you don't get if you don't ask. And so I want to take a moment and directly address all the Catholic sisters out there. In preparation for this event, one of the sisters you're about to hear from asked her sisters in 12 countries specifically about their WASH situation. And it won't surprise you to find out it was not good. But had she not asked, we would not know. And so, sisters, please speak up. Your leaders need to know your WASH situation. And leaders, please ask. And we all need to thank sisters, and I want to take a moment to thank Sister Teresa, who's my partner sister in putting this session together. And that leads us to Sisters Helping Sisters, which is our final section, which will be led by none other than Sister Gina Blanc, a sister of Notre Dame and the executive director of the Hilton Fund for Sisters. Thank you.
I think one of the best ways that we can celebrate Catholic sisters is by looking at the commitment that sisters have to WASH in its various forms. Catholic sisters are doing just that, as you will hear, and I am going to bring some numbers into this conversation. At the Hilton Fund for Sisters, we are privileged to have a substantial amount of money that came from Conrad Hilton, the founder of the Hilton hotel system, and the family no longer owns the hotels. But all the money from the hotels has gone into the foundation. And in his will, Conrad said, "Be sure to take care of the Catholic sisters." He was educated by Catholic sisters in New Mexico. And he said, "For they protect the children and those who have no one else to protect them." So the foundation put a substantial amount of money into a fund for sisters. And for at least 30 years, we were the funders of Catholic sisters. Now the foundation also has an initiative for Catholic sisters, and they put a lot more money into that initiative, but we're proud of what we do. So in the words of Sister Alessandra, we at the Conrad Hilton Fund for Sisters care for Catholic sisters anywhere in the world who are caring for underserved populations. I asked my program manager if she could run a report. So I asked her to take two of our areas of interest, safe water and healthcare, and find out how many projects we have funded in the past 40 years. We funded 154 grants for over $2 million, and 104 of those projects were in Africa. And that's just an overlap with healthcare centers. Now remember, every one of these grants was given because a sister asked. If we would overlap safe water and education, we would get an endless number of sanitation blocks that have been put into schools, especially in India. And if we just ran safe water, we would find out about all the boreholes and pumping systems that we have created everywhere in the world, especially in the global south. And each one of these projects was requested by a Catholic sister. Do you see the commitment? In collaboration with the Vatican Health Project, when they came up with the 150 healthcare centers, we asked how many were owned and operated by Catholic sisters. And we found, I believe the number was 37, maybe it was 47, were owned and operated by congregations of religious women. We wanted to help them, but we didn't know how. And Catholic Relief Services stepped forward and said, "We'll be the boots on the ground." So to date, we have provided sustainable WASH for 14 of those centers in the Philippines, Malawi, and Kenya. And we're currently working with Catholic Relief Services to put together another batch of Catholic healthcare centers in the Philippines. So since safe water is one of our priorities, the Conrad Hilton Fund for Sisters is in this for the life of the organization. And we will continue to work with the Vatican Project as long as Catholic Relief Services will continue to work with us. And now I'd like you to hear from some of my fellow sisters, Sister Mary John, Sister Teresa, Sister Irene, and non-sister Govinda, who is a collaborator and works with so many of our sisters worldwide. So, Sister Marjan.
Thank you. Good evening. I am allotted 1 minute and 30 seconds. So 2 minutes would be 30 seconds extra for me. Thank you so much. Yeah. I represent the International Union of Superiors General, which is just across the bridge here, the river, yeah, that is where we have the headquarters. It is an umbrella organization of the leaders of women religious congregations, about 1,900 superiors general. Now, superior does not mean superior in that sense. It is a canonical term. Yeah. So these superiors general also have members globally, around 600,000 sisters in the world, in different parts of the world, over 100 countries. Now, what is the, we talked a lot also about sisters and how marvelous and how wonderful they are doing. So I don't want to go into that because traditionally health and education have been, the predominant area of sisters' work. And they were so good at that. And because they were at the forefront where life was happening, especially at the grassroots, and especially concerning women and girls and children and rural health. So the role of the International Union of Superiors General is to support our members. Our strength is our members at the grassroots. So we are not directly involved with WASH. We are not a development organization or a development project, but we hold very dear the values and the passion of WASH. Coming as I do from India, I know how important it is, clean water and other facilities, So on a personal note also, I can vouch for it, the importance of WASH. What we could do is, how we could help is, like we have, as I said, our members all over the world, and at the grassroots. So, and we have at the OISG a very good communication system whereby we reach out to our members. We can use our platform to make known, to give greater visibility for WASH, and to engage our members to connect. I think it's all about connections, connecting, relating, networking, linking, and I think that we are quite good at that in OISG. And as I said, we are also, our faith-based approach, our gospel-based approach, the dedication of the sisters, where we stay in a place and somebody said, already talked about continuity and stability. And I think this is our strength, and that is where we could help. That is the commitment we can make, that through our members make known WASH to them and link and connect with each other. Thank you.
I'm Sister Teresa from Daughters of Charity International Project Services. I'm blessed to be in the same community as Sister Toyin. A year and a half ago, I was asked to take on the leadership of this community. And whenever you get a new ministry, it's like, okay, God, how's this going to happen? And people often ask me, because any of our 11,000 sisters in the 97 countries, well, in the low resource countries, so it's probably around 70 of those, can ask us and seek our help, like Sister Toyin, in finding the resources to do these projects that are critical. And I've dealt my whole life with poverty, and I kind of thought I knew it, but every time I get an application, I'm like, really? It's so different when you hear it on the news, and then you hear the stories written in the pictures of women spending 60% of their day carrying water, being vulnerable as they carry water, and it's still not safe water. People ask me, what is my favorite project? I said, it's the one I just read. And it is. And so as I was preparing for this, and as I've been in this first year and a half, I guess the scripture that's been speaking to me is that of the loaves and the fishes. In those 6 barley loaves, which were just multiplied. And I see that because God says, okay, here's WEFTA. Okay, here's this Vatican Dicastery Committee. Here's Sisters Rising. We can bring our little loaves together because we can't tell people to go away. We have to provide the water. And this are the groups that are going to multiply those loaves. As Daughters of Charity International Project Services, we are part of this first initiative, and we committed to 4 of the facilities. One of them you just heard about. Well, in the committing of 4, we have had 16 applications in for WASH in healthcare. And then they told the school sisters and the social services sisters, so that doubled. But we have done that, and many of those are completed. The 4 initial ones are completed. Some aren't. But then WEFTA talks about these circuit riders, and what are you going to do to maintain these? Yeah. And so now we have started working with them to put the circuit riders in, which is really, your basic maintenance contract, to not only go around and maintain things, but the education that Sister Toyin, to make sure people really know and use things properly. So we are really, I can just say we are committed to continuing to work with our sisters in creating WASH programs. A lot of these take a year or 2 or 3 by the time you get them done. So we're going to at least do once a year, and we just sent out one for healthcare, and we just sent out a notice, so we will be seeing who replies. But we also want to make sure that all the ones that we have done has a circuit rider program going, and that is just as routine as you getting a maintenance contract. The other part is because I believe in the multiplication of the loaves. One of my greatest gifts is I believe we can do it. And as I tell WEFTA sometimes, God did not make me an engineer, but he gave me an engineers to work with. And God did not make me as an educator, but we'll find out about Learning for Humanities and how they're educating our sisters. And so we will also commit to bringing the sisters and agencies together, that we can be the bridge. Anybody out there that needs to do a healthcare project, just talk to me, and I'll help you get it done. But we can be the bridge in advocating and linking people together. And when people in this day are concerned about where money goes, we can say 100% of every dollar goes right into the hands of that program. And we will assure there's outcomes from that program. So that is our commitment, because I know you're going to help me, so it's easy to make.
I'm Sister Irene O'Neill, and I'm a Sister of St. Joseph of Carondelet from Minnesota, USA. And I'm the founder and president of an organization that's new to this group. It's called Sisters Rising Worldwide. And our audience, who Sisters Rising Worldwide works with, are now I heard 600,000 sisters, I've heard 700,000 sisters, and I bet there's more, but we'll go at 650,000 sisters around the world. And that's the group that we work with. And we know that they know root causes of the problems around the world. And so we figured that if we help them, we'd help the world, right? Anyway, the other piece that we have is a map. It's called a Peace Room. It's a technology. Picture yourself opening up your computer and seeing the map of the world and seeing a little dot on all these countries, and you click on the dot and it opens up and you find out where all the sisters are and what they're doing and what they need. So that's my universe. And so we can ask the sisters anytime, anything. Now, I want to tell you a secret about nuns that you may not know, but nuns know, I'm telling you. When you send a survey to a sister, and it has like 5 questions, and yes, no, yes, no, yes, no, thinking that she'll have time to fill that out and that'll be great. Well, sister will fill out yes, no, and you'll get those. But on the side or on the bottom or on the back and attaching other pages, you will get what they really think you should be asking them. And what really you need to know is if you want to know what's really going on the ground, what's happening. And I have to tell you, it is so valuable. It is, those are the points that really I get interested in. So I have to say that when I was getting ready for this meeting for the first time, I thought I'm just going to do a little pulse with the sisters to see what are their needs with water, and what would come up. And so, of course, they said, yes, we have water, or no, we have water, yes, we have, hygiene, and no, we don't, and that kind of stuff. But their comments talked about the why of that. Why don't they have water? What happens? And why when they're in the middle of surgery, they can't finish because the lights went on, the electricity, which everything throws off, which goes into the hygiene, and it goes on and on. So anyway, they came up with this is a real quick pulse check we took. 90% of the sisters report no regular access to water. 80% of sisters reported insufficient, poor conditions for toilets. 75% of the sisters reported that they rarely or never or sometimes have water available. And 35% report that the medical facilities do not have reliable electricity. And all of those, of course, intersect with each other. So what we know about the sisters is that they are totally dependable. They're not leaving. They're not leaving when the electricity goes off or the water goes off goes away or whatever. They're going to stay there and do what they can. And if you ask them, or if they have an opportunity to tell you what's needed, they will tell you. So in response to the Sisters WASH needs, Sisters Rising Worldwide supports the sister-led projects that improve reliable water access and upgrade sanitation infrastructure and hand-washing facilities and things that you've heard everybody else say today. The sisters are on the ground doing that. In the future, Sisters Rising Worldwide will strengthen our role in advancing the WASH healthcare facilities by getting it up to the front line, by letting them know that we're interested. We want to know. Tell us what's really going on, and we'll spread the word through our platform. And when something comes up, we can do an immediate pulse check, is what we call it, and we can get actual data right from the ground immediately. And even what the little survey that I sent out was, we gave them just about 5 days to do it, and it was, and they came back with copious thoughts. So, anyway, so Sister Rising Worldwide will support sisters-led projects, and we commit to improve the WASH practices by helping the sisters as they send in their requests, and by advertising it to people. So what we do is we announce to the world, these are the needs that the sisters have right now, and you have ability to help make a difference in the world. 100%, we have 100% promise at Sisters Rising Worldwide, which means that 100% of the donations go directly to the projects when you give to Sisters Rising Worldwide. So that's our commitment. It's great to be here. Thank you.
Wonderful. Thank you so much. And as Sister Gina said, I'm Govinda Bilges. I'm the program manager of Learning for Humanity. It's a capacity building initiative of Medicines for Humanity, where we train Catholic sisters and frontline health workers on topics such as advocacy, project management, WASH, maternal and child health, and mental health, among many other topics that are pertinent to their context. I'm not a Catholic sister, but my vocation is education, and not only education, but very specifically public health education. And I knew this from a very early age growing up. Growing up in Mexico, I knew that I wanted to work in public health before I knew the word public health. And so I get the privilege to work with the best students, as Catholic sisters are. They aren't getting a grade for the training. They're not. They don't have to do it. This is professional development that they need, and they're doing for their own benefit and for the benefit of their community, which is absolutely incredible. They take courses and then they implement projects that they want, and we couldn't be more blown away by the types of projects that they decide to implement. They know what they need, they know the resources that they have, and they know what is going to serve their community best. So at Medicines for Humanity, we believe that strengthening health systems requires both infrastructure and capacity, because effective systems need people who are equipped to lead them. Today, we're proud to make the following commitments. First, as an organization, we're going to continue committed to improving the WASH in every healthcare facility in which we work through infrastructure, system strengthening, and community-based approaches. Second, through Learning for Humanity, we commit to waiving the tuition for all Catholic sisters and frontline health workers who enroll in our WASH program through September 2027. We also want to ensure that everyone who's already leading the care has access to the knowledge and tools to strengthen it. Second, Third, we commit to going beyond the training to provide mentorship for the actual WASH projects that they want to implement. And this includes mentorship through technical guidance, subject matter experts, and opportunities for feedback and support through our work, but also through subject matter experts. So if you want to be matched with a Catholic sister who is implementing projects, please come see me today or tomorrow and we can discuss. We're honored to commit to these alongside with all of the commitments that you are also making, and thank you so much for your time.
My name is David Douglas. I'm with Wallace Genetic Foundation, and it may seem incongruous to have a layman offering the concluding remarks here of a session dedicated to sisters, but the group pulling together this meeting today thought it was important to emphasize how absolutely critical sisters have been to this dicastery initiative from the very beginning. And I was glad to have the chance to say just a few words because my own involvement as a WASH implementer, as a WASH advocate, and a WASH funder really traces back to Sister Mary Joaquin of the Sisters of Charity of Mount St. Joseph, Ohio, who was working in a poor village in Mexico. And since that time, I have worked with many Catholic sisters, most recently with delight with Sister Teresa and her predecessor, Sister Mary Lou Stubbs of the Daughters of Charity. And during the last 6 years, right, Tebaldo, of the Dicastery Initiative, I think during times of discouragement that I've felt during that time, when you realize the urgency of this issue, that so many facilities are having to operate with lacking the basics of running water, functioning toilets, and adequate places to wash hands. During those days, what kept me from getting too discouraged was the memory of Catholic sisters working in the back of Beyond. There was one sister in the San Jose El Pinal down in the Branca del Cobre, Mexico, running a health clinic, and she and her sisters were operating in a village that you reached by taking a train to Creel, then hopping on a bus for a period of time, 2 or 3 hours, then hitchhiking on a mining truck, and then walking for 7 miles. That was the village that she was working at. As we've heard today, sisters are everywhere, and Jacinta's 20 out of 28 facilities have Catholic sisters as administrators, doctors, and of course, as nursing. If you look online, or if you ask AI online, what is the root of modern nursing, they will say Florence Nightingale, without mentioning that it goes back to Florence Nightingale being trained by the Daughters of Charity. So let me end with Pope Leo's apostolic exhortation and his commitment, the commitment to the poor that he just came out with, Dilexi Te. It's a section on sisters and healthcare. Sisters have brought comfort, a listening ear, a presence, and above all, a tenderness. They have built, often with their own hands, healthcare facilities in areas lacking medical assistance. The Christian presence among the sick reveals that salvation is not an abstract idea, but concrete action. So we should give thanks today, and I give thanks today, not only for the compassion, for the skills, for the unwavering faith of Catholic sisters, but what is less well known, their advocacy for the most vulnerable of the vulnerable, patients who are not only poor, but sick. So if you could join me for those giving thanks to those sisters in this room and those that are watching online around the world, would you join me in a round of applause for these sisters?
Thank you, sisters.